you've ever woken up in the morning with a stiff neck or found yourself feeling sore after an intense workout, chances are you have a trigger point. And in today's episode, we're going to talk about how we handle trigger point therapy here at Sage Integrative Clinic. Welcome to Elevate and Thrive. I'm here with Dr. Angela Yeagley.
Hello, Barry.
And this is something that all of us experience as people, right? We use our bodies, we live in them.
All the time.
Wear and tear happens. And so we find ourselves with these sore spots, tight spots, muscle knots, pain points, right? And a lot of times, I think people have heard of this idea of trigger point, but we handle it and look at it a little bit differently than a manual therapist might handle a trigger point.
Yeah, absolutely. I would say it's definitely coming from a more medical perspective. So most people, the lay person term for trigger point is going to be a knot, right? Most people are like, oh, my knot is bothering me, that I have a knot.
You might even think of it as a sore
Yeah.
muscle too, but yeah,
Yes.
with that intense maybe locus point of tightness.
Yes. Where somebody, you're telling somebody like, press right there, like get into it, use your elbow. That's your trigger point, right? And typically it's a center point, usually many times it's associated with the insertion point of the nerve. Not that that's important, but it's where we have decreased circulation, accumulation of lactic acid, calcium. Your body, anytime the body has pain, the body's response to that is to try to splint it and to make it not move. It becomes stiff, right? And so again, once the body does that in that response, it's going to, it kind of keeps compounding upon itself. It's supposed to be doing it to help you with pain. And maybe that does help temporarily. Say if your posture is bad, or again, you've been working out and maybe not, doing I know stretching is bad according to Head to Toe. It's my favorite holistic chiropractor group, but say you're doing functional stretching. I don't know what you call the right.
Yeah, or maybe you're not doing any of the active release stuff or the self-care. I mean, I think that for many of us, when we work out, we have a limited amount of time and we do our workout, whether that's lifting, running, a functional fitness, a CrossFit, industrious type thing, a lift, and we're out of time. And so we often will skip the foam rolling, the lacrosse balling, the muscle gun, all of that type of great body work that is self-care that can be easily done at home. We'll skip it over because we don't have the time.
Right.
And or, we've used what limited motivation we have to get our workout in. And so
it's all gone at that point.
That's what I had. I had that. I got my workout in. I don't have another 10 minutes. Yes. And so what will happen is then we can develop some of these points in our body, especially over time. I find with trigger points, they can be recurring, right? Or they can for a person have specific areas where they will habitually or routinely get a trigger point flare up. Yeah.
Absolutely. And so many times people were saying like my neck hurts or the upper part of my back hurts or I'm tight or again, they're just, you see somebody sitting there rubbing themselves, A
lot of low back pain. I can remember when I was big in CrossFitting 5-6 days a week. That's a ton of load on the body, obviously. And when you're in a CrossFit environment, you're doing a lot of low body work, a lot of heavy lifting and whatnot. And I was experiencing a lot of low back pain. And it turns out, a lot of times people think, oh, low back pain, that's spinal or something. But really what it was all glute muscle. It was all my big glute muscles.
Interesting.
Had a bunch of trigger points in there, tons of knots. And that was causing, those muscles to pull on other muscles and tight hip flexors and a cascade effect. But those trigger points were a big factor in the low back pain. So oftentimes when you're feeling an issue and you're thinking it's, you're sore, you're tight, you're in pain, a trigger point could be a factor.
Yeah, that's a great point. So let's dive into, how we would treat. So when you're thinking about an area of pain, absolutely, you want to look at the associated, like the insertions of the muscle, like where it begins, where it ends, and then because of fascia, which is essentially like it is connective tissue that we also call it like a body sock, so
holds things in place.
Holds things in place, right? Yeah, and so because it does that, you can have one area of pain, but it's being pulled on by another area that is tight or stressed.
And oftentimes where you feel pain is not where the origination point of the pain is. It can be a referral pain. That's very common.
Absolutely. Yeah. So for my own example, I have this chronic upper, trap like spasm that tends to come, and in working with Dr. Lee. So we work on, and also when I get trigger point injections, which I'll talk about here at the clinic, not only do we have to release the upper trap, but we also have to get into the subscapular, which is underneath, like in the armpit, right? So you're going in there to release it, as well as the occipital insertion, which is right getting up into, the ridge on the back of the head. If you feel back there, you can feel that. You have a lot of muscles that insert there, and that can lock down and start pulling and create headaches, things like that. So it's kind of like all the way at the top and then all the way around to the bottom, all of that is connected and creating a problem, even though I would say, like, as I'm experiencing it, I feel it at the top part of like the upper part of my back,
Yet the corrective exercises or treatments you're going through really need to address that whole area.
The whole area. Yes.
And that's a great example and a great illustration of going to see, say, a manual therapist. And so when you're working with Dr. Lee over at Head to Toe, we love the work that those guys do, support docs, support chiros. And they're getting in there and they're using a variety of manual tools, techniques, and treatments to help release and actively manipulate that tissue. Yes. Very effective. Now, often in addition to that, or as an alternative to that, we have another way that we can address trigger points as well that we'll sometimes look at. That's a completely different treatment technique to resolve a trigger point area.
Yeah. Actually, well, what's interesting is that, yes, it's different in the sense that we're using tiny needles, but actually very similar in that we're addressing a lot of the same exact points, So the reason why I really do like trigger point injection therapy is because, many times once people have let something go on for a long time and they have an area of significant pain, it can take, significant amount of time of manual release to be able to resolve that area versus what we do is we'll take a combination of a little bit of B12 for healing and then combo it with lidocaine, which is a numbing agent, or Procaine, which is also quite good. And then I follow it with the type of oxygen in that area. So, going back to when we have pain and we have the splinting and the calcification, we have decreased oxygenation in that particular area. And so it is like my absolute favorite. I've loved trigger point for years, and when I started adding oxygen actually to the injections, which I know sounds a little strange, but it's amazing, the therapy became, I would say, it doubled in effectiveness, and the treatment time was a lot shorter. So actually, I learned trigger point therapy through the pain clinic at Virginia Mason during my residency. And they do the same thing. They don't use B12, but they'll take like a big bolus of lidocaine and they'll get that knot, or what you feel like is your knot, and they'll inject that sucker. They'll just take a big needle and put it in and break it up. And so we're a little more subtle. I'll go beyond that.
Because that can create that technique can create some soreness.
Yes, afterwards, some significant soreness. If you do large injections, it can be effective, but sometimes temporarily for a day or two, you're going to have a lot of pain after that.
So what you've developed here is a more gentle, more effective way to use injection therapy for trigger points that doesn't really create that same level of soreness after the fact.
Exactly. It might a little bit. I do recommend still that you ice just a little bit because I'm hitting multiple points. And I will still, if somebody has an enormous area of just that it's calcified, it's huge, then I'll do some deeper injections, especially in those, the low back, the big muscles of the low back. You have to kind of get deep in that area. Or if you're injecting the glutes, or if you're injecting hamstrings or, those are bigger muscle groups. So sometimes you have to go a little bigger and deeper.
Yeah, it's kind of interesting with this therapy because you can actually see when you identify and physically locate say a trigger point, and then you inject it, you can kind of see it resolve, and it will loosen up, and the trigger point will essentially release.
It releases and many times starts breaking up. I mean, that's kind of the nice thing about when you're doing injection therapy. You can have that with manual therapy too. Many times you can, if you have a really good practitioner and you're dealing with something that maybe hasn't been there a long time, they can get it to release and you can feel it go, which is pretty cool. And it's the same thing with injection therapy. A lot of times I would say you kind of will go in that direction if you've already experienced manual therapy and it's not quite getting you there. It's not resolving it, or it's really large and you just need kind of a little more significant therapy to kind of help break it up.
Or you're here and there's some other things we're working on, and we're working on that as well. You know, it just saves you can save you a trip, but it is something to be aware of, and I don't think a lot of people even know about that therapy from a treatment standpoint.
Right. And it's something actually, it's because it is a traditional treatment, we can use insurance for it, which is pretty cool. We just charge a little extra for the oxygen part. And the reason why you would do it, you think, why would I want to be injected with a little needle? Like, this does not sound like no, it's fantastic. You leave, many times when we're doing it, people are in pain. They're actively hurting. They in whatever area of the body that we're talking about, or they're getting headaches. And so we do that therapy a few times. Generally the one therapy you leave and you're pretty pain-free, which is pretty cool. But we might need to repeat it.
That's a great call out. Ultimately, this is a pain relief approach, right? So you're in pain, you might have limited maybe mobility, limited movement. It's the pain starting to impact your day-to-day functioning or your ability to concentrate. I think about people who get, working at desks, looking at monitors, they get that intense neck pain, let's say you're even getting active manual therapy work done and you're working a process there, but you want to speed it up or you want to supplement. This is also really great in those scenarios too. So it can be used as a standalone treatment that can produce results really quickly. And it can be used in conjunction with other therapies that you're using as well. Yeah,
and that's generally what I recommend, because you want to work on, many times
postural.
It is exactly, and sometimes strengthening,
movement patterning.
Yes, yeah, and then also good habits after workouts, right? Of foam rolling.
That's right, breaking up those self-care tools.
Right, which I know Barry and I know we could be better at. You still want to do those preventative things, but really 2 to 3 treatments of kind of a stubborn area that's creating pain can be incredible.
Would that happen over the course of a week? Generally, or the course of 2 weeks, or how does that?
I've had people where, say we're dealing with something more acute. Maybe they have a muscle strain, and then their trigger points have just compounded that issue. And so we're gonna inject, around the muscle strain too. We can treat those, and the one treatment is incredible. And they come back that same week, and we do it again the second time. Most people for something chronic, it's going to be like once a week for 3 weeks. Would be kind of a standard treatment protocol. It was maybe an extra one later on if we feel like we need it.
Yeah, very doable. Yeah. So we're not talking 36 treatments here. We're talking handful of treatments.
Probably not. There's probably something else going on if we
absolutely
think we need to do that many treatments. So,
well, if this is you, if you're hearing this or you're thinking of this, and just tuck it away, even if you don't have an issue right now, and just remember that when a type of situation pops up that's like this, trigger point can be a really powerful solution for you.
Absolutely. Yeah. Come in. I'm happy to evaluate you. And actually, even if that's your focus for the day, I can just go get it prepped and we can do it right when you come in. So it's super easy.
I love it. Yeah. Awesome. Well, thank you for sharing, and we will catch you on the next show.
Bye-bye.